Hi, everybody, and welcome to our second episode of our Apollo Facebook live feed. I want to start by thanking you for joining us. And again, welcome to the presentation. Welcome to the feed. Today's topic is going to be called CBD and anxiety, something that is very relevant right now. But initially, I'm just going to start by giving everybody a brief breakdown of starting with myself, who I am, where I work, and just a brief understanding of the endocannabinoid system and medical cannabis and how we use it. So let's dive in. The first thing that I'm going to discuss with you guys is a topic that we often hear in our clinic, and I want to make sure that things are well understood. We can almost call it a bit of a myth that exists in the world of medical cannabis. Many of the patients who come to our clinic will always start with the oral form of cannabis. So we will start with a CBD oil, and don't worry, I'll discuss what CBD means, or a CBD and THC combination oil, and I'll go over what THC means as well. Initially, when we start, patients are given a small oral syringe. This oral syringe has many markings on it, and you will pull out the amount that you are going to use, your dose, and a lot of patients are being told that they need to put that under their tongue, and that's how the medication is absorbed. So it started off with us telling patients to put it under their tongue, and then patients start to think, well, it's absorbing under my tongue, and I need to keep it in my mouth for longer. Truth of the matter is that cannabis, the plant itself, is 97% carbohydrate based, but the medication that we attain from the plant is a fat-soluble medication. When any medication is fat-soluble, it requires first-pass metabolism. So the myth being that it needs to go under my tongue and wait there is not true. It needs to be ingested. So we go back to why we were telling patients to put it under their tongue. Well, it's a bit funny to us, but we were having patients use the oral syringe with a lot of distance, and they were missing, and they were getting it on their face, or some patients were saying it got in their eye, and they were very, very upset about that. And they would call us and say, well, what should I do next? I've got some cannabis oil in my eye. And we would tell them, it's okay, just wash your eye and clear the oil. And then next time when you take it, put it under your tongue so you don't miss. And that's literally where the myth started. So it's just an opportunity I would like to take to clear things up with you guys. So again, let's dive a little further into what our presentation is going to be, our agenda. We have about 15 minutes for me to go over a few set points that I have. Then I want to dive into questions. It was the most popular portion of our last visit. So remember, these presentations are designed to help people understand. They're from a standpoint of education. But if you truly require medical advice, I strongly recommend you make an appointment with us to speak one-on-one with one of our healthcare professionals. And with this whole thing that is going on, please remember we are still fully open and functioning on a virtual platform, guys. So feel free to reach out to us and contact us in any way, shape, or form that you wish. I'm going to be telling you guys the information as I go, and there'll be plenty of times where I mention how you can get in touch with us. So I'm going to start with myself. My name is Arash. I'm one of the medical graduates that works at Apollo. I'm a patient care specialist. I spend a lot of my time working closely with patients, with physicians, also with our research department. Leading into Apollo. Apollo was initially a research institution that was started only to pay attention to the data that was coming back to us from the very limited physicians and patients that we were able to access. It grew. Then eventually a lot of the physicians told us that they'd feel comfortable prescribing medical cannabis to patients who required it if they were under the supervision and observation of our clinic and of our institution. So that's a little bit about us. Since then, we have become one of the largest networks for medical cannabis in the country, and we have multiple research projects going on. One of the ones that we're most proud of is probably, I would say, cannabis and its opioid-reducing properties. We've also done a lot of safety profile research recently as well. So we work closely with the Municipality of Transportation. We've worked with large patient bases. We've worked with other research institutions. Recently worked with the University of Toronto. So we're firmly in touch with all of the new developments for medical cannabis as well. And it's interesting. People always think, well, research is you throw a bunch of numbers out there and you see what comes back. But in reality, we take theory and we have an understanding of what we want to attain, then we try it and we record it and we see if we were correct. If the research and the theory match, then you have a treatment option. Let's move forward. So when I say things like CBD, when I say things like THC, it's important for us to have a bit of a background. CBD stands for cannabidiol. It is a chemical compound, a molecule that comes off of this plant that has a receptor it can connect to in our body. It is a receptor that is already in place. We're not adding anything that your body doesn't have. We are tapping into the endocannabinoid system. In this day and age, with the climate that we are in, with what is going on around us, there's a lot of rapid change. Rapid change causes discomfort for anybody, for everybody, right? It's across the board. It's a big brush and it paints on everybody. So this is something that we've had to frequently address recently, and CBD is the main chemical component and the main portion of the plant that we use to address some of the conditions that can come from uncertainty, quote unquote anxiety. Another thing that's important to remember when it comes to cannabis is that there are receptors in our body in multiple systems. We hear sometimes in clinic, well, I started using it for my migraines, but it also helped my anxiety, and it also took away some of my back pain. And is this actually true, or is this something that I'm thinking I'm feeling? Is it, a placebo effect? Is it false that way? And we have to very quickly explain to patients, no, that it can help your system in many different ways. It can help your body through many different systems. So it's important to remember. Another thing that I want to touch point on before I move forward is going to be THC itself, okay? THC is the chemical component of medical cannabis that people will always equate to the recreational side of things. Guys, this is not true. CBD and THC have a firm place in the medical world. THC, if unmeasured or uncontrolled, can have negative side effects. Like any medication, there's a side effect profile to it, and that is something that we counsel and coach our patients on. So, our medical process is something that we have perfected through time. It is often tested when patients come in, and we have to spend a significant amount of time with them and make sure that they are in full understanding of why they came to Apollo in the first place. I actually heard it said very well from a family doctor the other day. He was seeing a patient, and this patient ran out of treatment options for their physical condition, and what he told them is, you should investigate medical cannabis. And that's a very, very great thing for anybody to hear, because right now, investigation of any medication is very easy. We have Dr. Google, and they can answer any question that we have. But for you to come to an institution that understands it very well is important. In the current state that we are in, anxiety is something that we're hearing a lot of, right? And I want to talk about exactly what anxiety is, how it affects our bodies, and how it can cross over multiple systems as well. Anxiety is due to either environmental or genetic imbalances of neurotransmitters. Guys, I want this to be fully understood. A neurotransmitter is a substance that your brain produces in high or low amounts and can have effect on how you feel or how you think, okay? Initially, anxiety is a neurological process. And again, something happens, it can be environmental, or you've always been that way, it's genetic. It starts off in the neurological system, and then eventually, if someone is anxious, they have difficulty with other parts of their life. For a good example of that is a person who is anxious has a reduction in their sleep cycle. So a neurological process has reduced their sleeping cycle, has now crossed over into a psychiatric condition because they're just not themselves anymore. Another very, very common one we see is I am so anxious that when I eat, my stomach is just upset and I can't hold food in, or I just don't have an appetite the same way I used to. And again, that is a person who has a neurological condition that is crossing over into the GI system. And again, it's affecting their life. It's affecting their life. So it's important for us to recognize this. Some people will just keep it to themselves. Some people will say, well, this is something that I've gone through in the past, and I know in a couple of months it'll pass. Or some people will say, this is how I've always been. I've never sought help. And now all these new campaigns are saying mental health is just as important as any other physical component of your body. So we need to talk about it. We need to address it. It needs to be out and open and for people to feel comfortable. It is not a weakness. It is a condition. So it's important to remember that, guys. It's very important to remember that. Another thing that we want to do during this presentation is kind of discuss how CBD can help. what is the exact physiology of CBD and its place in mental health. A lot of patients who come to us and say that they started the use of CBD are always excited to report back and say, hey, guess what? I started using this and I don't have the same issues with my stomach, or I'm not getting a racing heart, I'm not feeling as anxious. But my mindset is still the same. I'm still tending to overthink. I'm still tending to react first before I think about what I want to do next. So it's important to remember CBD has receptors in the central nervous system. It can help with symptoms of anxiety. Initially, it helps with what we call symptomatology, which is a fancy way of saying how your body feels due to the anxiety. So things I've already mentioned, increased heart rate, a faster respiratory rate, an unsettled stomach, jitters, right? Unsettling feelings all the time. So CBD can initially help with that very, very, very rapidly. Within a day or two of finding the correct dose, you feel a lot more at ease. But we at Apollo mimic exactly the process that is already in place for the treatment of any mental condition. The receptors for CBD to get to require time. So although you are feeling okay after just a few days of use, we have to get a true understanding of how we've addressed your anxiety after 4 to 6 weeks of use, which is the exact same thing any doctor will tell you when treating a condition in that nature. So it's important for us to explain that to patients as well. And we don't always get this amount of time, so it's excellent for me to bring it up in this presentation. One of the other things that we also wanted to discuss during this process was CBD and its ability to address sleep. Too many people think that THC must be involved for sleep assistance, and it turns out 9 times out of 10 that is the case. I'm not going to say otherwise, but initially, every sleep disturbance is treated with CBD to see if there's an underlying issue that is causing a sleep disturbance. This conversation is not about chronic pain, but one of the main reasons people suffer from sleep disturbance is chronic pain. Second to that is anxiety. So if I'm treating the underlying cause that is keeping you awake, then we don't need to venture into the world of THC. But if I treat the underlying cause and you're still awake at night and thinking about things and only getting a few hours a night and then your productivity the next day is affected, well then yes, we need to venture into the world of THC. And remember guys, this is not something that we give freely, and we're not going to just throw THC at people. We come in at a very calm and collected, calculated dose. Right? So it's important to remember that. It's important to remember that. So moving on, some of the physical signs and symptoms of anxiety are often talked about in our clinic, and one of the main ones we get is heart palpitation. Right? That's a very, very important one that we cross. And the reason I want to bring this up is because a lot of people will say, if I use cannabis, is there a chance that my anxiety will get worse? Because that's what I've heard. So-and-so tried cannabis for his anxiety, and the poor soul spent hours just sitting at home and trying to combat his situation. Guys, that is a classic case that we hear in clinic, and it's due to people using cannabis incorrectly. Okay? That is someone who has not been explained what to use or how to use it. Method of consumption is important. And for that reason, they're struggling. For that reason, they attain the side effects and none of the benefits. So that's important to know as well. How are we doing for time, guys? I think we're doing okay. I am going to move on to questions. This is always our favorite part of the show. Let me see what I could pull up, and then we'll dive right into it. And again, guys, thank you so much for joining us, and thank you so much for your questions. I'm going to get to as many as I can. First one here says, I would love to know how you determine the appropriate level of CBD oil to take. I have some anxiety as well, along with IBS. I'm going to say it one more time. How do we know the correct dose of CBD oil for both anxiety or IBS? IBS stands for irritable bowel syndrome. Irritable bowel syndrome. Now, this is a condition that is kind of an umbrella term. It covers a lot of different symptoms that occur in the GI system. Generally, your doctor will want to be more specific with the diagnosis, so they'll run some objective tests, blood work, markers. There are many things that they can try. If they are unable to really nail down what's going on with you, but there is no doubt that there is something going on, they call it irritable bowel syndrome, which is, again, an umbrella term to cover the GI symptoms that you are feeling. So we treat the dose of this medication like any other medication. The only difference with cannabis and traditional medication is I don't really have an excellent starting point, so I start at the bare minimum. And I tell patients that. Initially, you may feel nothing, but we have to be patient. We have to be patient. You will start off at such a low dose that it will probably have no effect, and we'll move up every 3 days. And by the 12th day or 15th day, patients generally have an understanding of what they want to feel. And again, remember, I'm going back to what I said before. Although the symptoms of anxiety physically may reduce, to actually address the condition, we need 4 to 6 weeks. Now, I really like this question because it comes at 2 different angles. First, we are attaining the neurological benefits of CBD. Second, we are going to attain the anti-inflammatory properties of CBD to address the irritable bowel syndrome. No matter the condition, when it comes to irritable bowel syndrome, there's a lot of inflammation involved. It is an inflammatory condition. It is an autoimmune condition that causes inflammation. So we can treat it that way. Another function of CBD, and I don't want to get too off topic, but another function of CBD is that it works as an immune modulator. What do I mean by that? Immune modulator means that it can slow down an overactive immune system. It can slow down an overactive immune system, but it'll never take the immune system to a point in which it is unable to protect our body. That's very important. That's very important because a lot of the medications that are in place now for the treatment of autoimmune conditions put people at a huge risk for other infections. If I turn off your immune system, a simple infection can run rampant in your body. So it's actually, it's interesting. If you look at any of the immune modulators or any of the medications that are used for any autoimmune condition, they will say, please speak with a healthcare professional at the earliest sign of fever or at the earliest sign of infection. So it's very important. It's something that a lot of physicians have. Great question. Thank you for that. I'm going to take another one, guys. Oh, wow. Okay, wow. Great. So this is more of a statement, not so much of a question. Richard, thank you so much for this. CBD works so much better than clonazepam. Clonazepam is a medication, a benzo, that is used to be a calming agent. When a physician takes a medication and gives it to a patient for use other than a calming agent, we call that off-label use. So a patient might be using this medication for sleep. A patient might be using this for anxiety. There are many different places that those medications can be used. So thank you for that comment, Richard. He says it's working excellently and he hasn't experienced any of the side effects. Some of the side effects to a medication that can cause sedation is oversedation. Simple enough. You take it to go to bed, but when you wake up the next day, you're not feeling like yourself, and it might even take several hours of your day away from you just so you can get caught up. Here, I'm going to take another question. So, what is the recommended dose for CBD, THC for anxiety or mood disorder? Really good question as well. I have already briefly touched on what the dosages should look like. Initially, you are starting at a dose that is so minute that you'll feel nothing. But that's okay. That's the plan. We want that. Because when you get into a place where it's therapeutic, now you know your dose. Then, if you go a little bit above that and you feel a side effect, you now know what you don't want to feel. And we stay beneath it. It's quite simple. It really is. And the advantage to us being able to do that is that the side effect profile of cannabis is so low, this stuff is so benign that we are allowed to come into a dose and move up slowly and stop where we need to. So thank you for that. Gabby, that was a great question. Thank you. All right, guys, I'm going to get into, okay, true. Right, okay, there's another comment there that I read that's not really a question, guys. I'm going to take one that sounds a little bit more today. Is there some sort of price adjustment considering people at home are not working? That's a very good question. Is there some form of price relief or benefit with all that's going on? I'll tell you this much, guys. There are many, many, many companies that produce cannabis as a medication. The advantage that we have as a doctor's office is I can go to exactly where you need to go. I can cater a treatment plan to fit your needs. I can make it so it's, well, not just me, but Apollo can ensure that whatever treatment option you have been advised by your doctor or your nurse practitioner, I can find you the most economical route for it. Of course, none of our services have a fee to them. Apollo is completely covered by Ontario Health. So, and also we don't charge for any patients because we do see patients across the country. We are coast to coast, guys. Keep that in mind. To take another question. Oh, this is an interesting one. Which terpenes act best for anti-anxiety? And what's the difference between ingesting CBD in a soft gel or oil or inhaled? Wow, so we have multiple questions for that one. Okay, so let me start with the first one. Terpenes. What is a terpene? Great question. So I had to learn this myself. I had no idea what a terpene was not too long ago. Terpenes are the scent, the aroma, the flavor of any plant matter. Any plant matter. If you go for a hike and there's a pine tree and you pluck a pine off that tree and you smell it, that is its terpene profile. Cannabis, because of the unique ability of the plant to absorb a bit of its environment, has many, many different terpenes in it. One of the main terpenes that we know about in clinic, and again, anecdotal, but we've heard it from our patients, so we don't ignore it, is linalool. That is the terpene that comes from the plant lavender. So many people will use lavender oil and think, wow, this is calming, this is soothing, this is relaxing. Some people drink lavender tea and it helps them. But again, the plant is very unique in its way that it can absorb some of its environment, and linalool is the terpene that was discovered on some strains of cannabis that can be very helpful for sleep. The other terpene that we know of, again, things that we hear in clinic, is myrcene. Myrcene is an interesting one as well. It's found in mangoes and other very, very sweet fruit. But it's also found in cannabis, and we've heard multiple reports. Again, patients tell us, when I use a strain or a capsule or an oil that has myrcene in it, it has a very calming, relaxing effect for me. It helps my anxiety, which is great. We love hearing that stuff. Second part of this question. When ingesting CBD by soft gel or oil. Remember, guys, the soft gels are no different than the oils. As discussed in the beginning of this, first pass metabolism is required. When you ingest a capsule and when you ingest an oil, it goes down into your stomach, over into your intestines. Your liver is the organ that is responsible to redistribute all fat in your body. So it'll pick it up, it'll stamp it, and it'll say, now you go to work. And it takes about 1.5 hours to 2 hours to feel it, but first pass metabolism is required, and it's the same for oils and capsules. When you inhale the medication, it goes into your lungs, past the capillaries, into your bloodstream, and the medication acts very quickly. So that is the main difference. Now, I've addressed this before, but yeah, I don't want to take too much more time on it, but just understand that the method of consumption makes a difference on the time in which the medication works in your body. All right, let's see if I can get another one here. Can I get cannabis at a rec store for anxiety? Oh, great question. Very relevant question. They're open because they're an essential service in Ontario. Well, guess what, guys? So are we. We're a doctor's office. We are allowed to stay open, but for the safety of all patients, our staff, and ourselves, we've made our entire platform virtual. All of our appointments are conducted now over the phone or via telemedicine. We've actually had a great response. So let me get back to the question. The answer to that would be, it depends. It's difficult for me to answer because I don't know what the stock is at a dispensary, right? But what I do know is that a dispensary is designed to give people recreational access to cannabis. They're not going to have products that are high in CBD. They're going to focus more on the high THC, right? So it's similar to saying, if I go to any institution that sells alcohol, am I going to find medical grade? Am I going to be able to find disinfectant? And the answer to that is clearly no. So I would treat it the same way. When you go to a dispensary, it's difficult to find CBD, and not to mention the prices are much, much higher. Again, I leave that to the world of recreation. I don't want to throw shadow at anybody, but we understand medically we have far better CBD products. Great, great. I'm going to take another one here. Sorry, guys. I'm looking at multiple screens. Give me a second here. There it is. Oh, that one's also very similar to what I just explained. I went to a walk-in dispensary, and it was very expensive. Okay, so similar to what we've already just discussed, what other alternatives are available for me? Second part of that question is very important. Remember, guys, if you're using cannabis and it's helping you from a medical standpoint, then it's very easy to make an appointment. You will simply be honest with your doctor and you will say, guess what? I've been using this for 10 years for sleep. I've been getting it from a dispensary, but with all that is going on, I prefer to remain at home. I prefer to respect the responsibility of social distancing, and I would rather have a service that can come to me. With a medical prescription, your medication is shipped directly to your door, and that is a Health Canada approved service, guys. This is not something that we're offering just now. This is something that has been going on since the beginning of medical cannabis, since as far back as 2012 for us. So being in the space, being in the realm of medical cannabis for 8 years makes us a wily veteran. That makes us way more experienced than anyone else out there at this point. That was a great second half of that question. So here's another question that I have. Looking for sleep recommendations. Okay. Doctor thinks it may be anxiety related. Wow, that's very into tune to what we are saying here. So there's a person who is coming to us or generally stating that they have trouble sleeping. They've been told by their family doctor that it's anxiety related. I've already said this, but I'm going to repeat it. Initially, when we address sleep, we address the underlying causes of sleep disturbance. So you will start with CBD. We will touch point and see if it is working. Sometimes up to 2 weeks to a month, we can reassess how things are going. And then we can say, okay, you've gotten to a point in which you are feeling the effects of CBD. You are attaining some benefit, but you are still awake at night. So we need to bring in the second chemical component of medical cannabis, and that is THC, right? And that right off the bat scares people. But remember, when we come into any form of medication when it comes to medical cannabis, we are using a very, very small dose and graduating up slowly. So for your reference, we would come in at 2.5 milligrams of THC. Majority of patients feel nothing, okay? They call back and say, well, I took this 3 nights in a row, nothing's changed. Well, we say, good. That's information that we wanted to hear. That's information that you now have. And now we're going to go from 2.5 to 3.5 or 4.5 or 5. And then they'll call back and say, hey, guess what? I went to 7.5 and I'm sleeping great. This is fantastic. Let me just take one more question, guys. Does the combo of CBD and THC work better? That's a good question. There is a term that we have in clinic, and we call it the entourage effect. Okay? CBD and THC have a very similar mechanism of action in our bodies and our peripheral nervous system. So neck down, CBD and THC work very similarly. In the central nervous system, THC, if taken at too high a level, can cause a stimulatory effect. Having said that, the right amount of THC with CBD incongruence can affect both the peripheral nervous system and the central nervous system, giving someone complete relief. So it's important for patients to understand that. Too many people are afraid to jump into the world of THC because they think, well, now I'm using something that might make me feel uncomfortable. Guys, if anybody feels uncomfortable from a prescription of ours, then we have failed. And we firmly know that. So we don't let it happen, and it's not something we experience often. So it's important to remember that. Thank you for that. The entourage effect, guys. Okay, I'm going to take a question from Tracy. Okay, how long of a shelf life does CBD have? Now, we've discussed this in the past, but I'm so happy to discuss it again because we're having more and more viewers join us every week, so this is great for us to review. These medications, these oils, have a very similar shelf life to any cooking oil. In fact, their suspension is with coconut oil. It's an MCT oil. So again, I mean, think about how long you would hang on to a coconut oil or how long you would hang on to an MCT oil. Now, the fat particles that come off of cannabis are a little heavier, so sometimes they'll tend to settle at the end of a bottle. That's a quick fix. You just give the bottle a shake, and the medication is ready to go. I'm not sure what to compare it to, but that's something that we have learned in clinic. All right, guys, one more question. I have time for one more question. Let me see. Sorry, guys, this is just loading as it shows up here. Oh, okay, very unique. I would love to know if I can mix equal amounts of my favorite oil, olive oil, for taste with my current dosage of medical cannabis. Yes. Yes, you can. And I'm going to take a minute and I'm going to talk about something that isn't really cannabis related. Whenever we consume a healthy fat, a plant-based fat, olive oil, a coconut oil, it causes us to mobilize and use other fats in our body, and it expels them, so it gets rid of them, right? Now, the misconception is, well, if I take olive oil and coconut oil and I cook with them, I'm doing my body a favor. Guys, those oils are best used in a raw form. When you cook with any oil, you push it past its smoke point and it denatures, and now it just becomes any other oil. So yes, please take that olive oil in a raw form, guys. Guys, we are nearing the end. I want to end with a token of gratitude. Thank you so much for joining us today. This is something that we're going to continue more regularly due to its popularity and high demand. Send your questions to us, right? You can send them right here on our Facebook feed, or you can email us at marketing@apolloresearch.ca. Also, the phone number for the clinic here is 1-877-560-9195. I'm doing my best not to look. So remember, we are fully up and running, and actually have been doing very well with our entire platform moving digital. So don't feel like you can't reach out, and it can all be done while you're remaining responsible in the comfort of your own home, guys. Thank you so much again, and if I didn't get your question today, please remember that I will go through this, and I'll bring questions for the next episode from this episode as well. Thanks again, stay safe, and we'll talk soon.